Dr. Renato Oliveira y Sosa, Chief of Mental Health and Substance Use Unit at the Pan American Health Organization, James Sale, Deputy CEO of United for Global Mental Health, and our moderator, Maggie Lake, for a conversation on the next generation of mental health.
Hi, everyone. Wow, that was a fantastic conversation, such an important topic, and we are going to continue with that and move from talking about cancer to another epidemic that perhaps we don't spend as much time talking about that in venues like this, at forums like this, and that is mental health. So happy to have you all here. I'm so excited about this conversation. James, I'd like to start with you. I think we anecdotally feel and all know that there is a growing mental health crisis, and I'm sure if I asked everyone around the room to raise their hand, if you know someone in your network who's struggling or has been struggling, or in your family, all of the hands would go up, especially in this post-COVID era. But just sort of frame the issue for us that we're dealing with when it comes to mental health and where we are at this juncture.
Yeah, thanks very much. You're right. The mental health crisis, or how people refer to it in different ways, is there. And I think but the response in terms of interest and awareness is matching that. You know, we mentioned there about the pandemic accelerated some of the issues around mental health, but actually I think it also accelerated some of the awareness. When we look at structural issues around mental health, let's take financing, for example, public financing. Public financing for mental health has stagnated at around 2% of health budgets for the last 15, 20 years. That hasn't massively changed. But we know that the burden of disease has. And so whilst we hear quite a lot of support, particularly in the forums like the UN General Assembly or the World Health Assembly and other places like this as well, we're not seeing the structural side of things like financing really match that.
Which is a major problem, and again, something I think we find across sustainability and health when we're talking about that. Stella, you have clients across the corporate world at Cigna. What are you hearing from them, and how are companies being impacted by this? What are they seeing on the front lines? Because in many ways they are.
No, absolutely. I think I always say that I've been in this business for so long. There was a time when wellness was more like a checkbox item. But after COVID, now employees actually come because it's impacting not only the health of the employee, it is impacting productivity, it's impacting medical cost. And what we've also seen is how the whole concept, now it's no longer mental health. It's not watertight compartment where you say this is mental health, this is physical health. You know the whole connection between mental, social, environmental health, and even occupational health. All these impacts someone's well-being. So that's how now, even as we have evolved our conversation around the whole health or vitality, how can we talk about somebody's vitality, taking into consideration all these factors. And our employers, for instance, many of our individuals, we depend on our employees for our health insurance, like accessing health benefit or getting even access to your wellness tool. So that is in fact the central theme, I would say, of how we come into the picture. What James was talking about, that in public health there's not enough funding. That's where the private partnership through this financing model of health benefits, which has now richer implications with well-being benefits. So that's one thing. The second thing also I would highlight is the capabilities that we build. Because we have this global presence across the world, access to healthcare providers, access to technology, telehealth, and even counseling, both in person, on site, and virtually, especially in parts of the world where we know there are challenges in having mental health resources. How can we use digital tools to support? So these are also some additional tools that providers, private partnership can help to alleviate some of the issues that we have currently.
which is so critical. Renato, I feel like we're talking about financing, but I want to just take a step back and talk, especially when we're looking at this as a global issue, about detection and recognition. Mental health is a very big bucket. Where are we in terms of health systems to being able to identify exactly what's happening and what we mean by that?
Thank you for the question, Maggie. And that's very important because the work that we do at the Pan American Health Organization, we work directly with ministers of health, with ministries. And this is usually the type of question that they bring to us. We see how mental health is important. We realize the problem that we have here. But how can we make changes? How can we improve or create systems that, in fact, we don't have to address mental health issues? So the good news is that there are many solutions that can be used. Each country will define what will be the steps that they will have to accomplish, of course, according to the resources that they have. But let me also say that most of the countries don't put enough resources in mental health. So that's a very important starting area, and probably the first recommendation that we give: please increase the resources that you devote to mental health, because by increasing resources you'll be able to take the next steps. A very good next step would be to integrate mental health into the primary healthcare system. So we know that the best solution in terms of general health is to make sure that healthcare is as close as possible to the population at the community level. And for that, we create primary healthcare systems that they cannot address everything, but they are the door where people get immediate help, might be supported or referred to higher levels of care. And in that expansion of primary healthcare systems that we see in many countries today, it's fundamental that mental health is an integral part of the primary healthcare system. So these are steps that will help the country to move forward. Many countries also come to us and say, well, we have a few specialists, and the specialists that we have are not able to address all the problems that come to them. Well, so let's then support the primary healthcare system. They will be trained by and supervised by the specialists, but at the end of the training and the supervision system, you don't have anymore just one specialist, but you have a group of doctors and nurses that can address the needs of the population. These are some ways to take steps forward.
You read my mind, because I was thinking training as well, especially if this is an issue that wasn't addressed on that front line. But James, this brings up a really important point, because we know, especially post-COVID, that healthcare systems are stretched to the max. And when you're looking at funding, I can imagine that there is a conversation that takes place when you've got people coming through the door who have immediate physical ailments that may mean life or death. And if you're talking about resources, especially strange resources, how can they get past that hurdle? Or do you hear from them, I need to put my budget toward this, and then there's nothing left over for mental health? I'm sure that's why it's at 2%. How do we get past that problem?
Yeah, I've yet to have heard or met a health minister who's told me, I've got all this spare cash I don't know what to do with. Yeah, it's a real problem. And I think, you know, what Renato was talking about there is about integrating mental health services into the primary and community level care. And it's absolutely what we need to be doing. At the moment, in many countries, that small percentage of financing, that small amount of financing, is focused on tertiary facilities, long-stay mental health facilities, mental health asylums, psychiatric hospitals, etc., where the vast majority of people do not need to be treated, where they are hotbeds of human rights abuses. In fact, I would go as far as saying that the institutionalization of many, many, many people around the world in mental health facilities is the scandal in global health that nobody's talking about. It's about integration, therefore, moving away from that, but also not just within the health sector. I think too often we think that mental health is the sole responsibility of the health ministry, and therefore the sole financial burden of the health minister. Yeah. We need to think about it across the government. Mental health is a cross-societal issue, therefore it requires a cross-governmental approach as well as other actors. A few years ago, we were asked by the government of Liberia to do an investment case on their mental health policy. It was a really good, modern policy, but there was no funding for it. The budget the year before was $25,000 for the whole country. In fact, only $10,000 has been spent, so it had like a 40% execution rate as well. But we looked at that, and then when we sort of, this is a phased plan, and this is how much it would cost to fully implement that. And we said, what it comes to is it's going to be about 12 to 13% of the health budget. And going from 0 to 12 to 13%, even over a decade, was something that the minister was thinking, we can't do that. Because the halfway point of that was during the parliamentary cycle, and it was still going to cost a lot of money. But when we framed that as general government expenditure, it became around 1%. And the conversation was a way easier one to have with the Finance Ministry and with the Treasury as well, to say, look, this is around a 1% investment over that period of time. Which
how
is
do you get it into that line item? Because I think we're all wondering what justifies moving it to general government expense?
So in good mental health policies, and Renato knows more about this than I do, but in good mental health policies, there will be provisions for education systems, for the penal system, for social welfare interventions. There will be provisions in there for ministries and sectors of the state which aren't just the health ministry, and that's the entry point.
That's so interesting. And Renato, I'll get your thoughts on that in a moment. But Stella, layer on that, if you can do that, for employers, is there a parallel there as opposed to thinking of it purely from a health line item to something more holistic within their organization, and can they contribute to that conversation as well? What are some policies that you've seen that are working when it comes to addressing it in that whole person aspect?
I think employers have realized that if they don't deal with this, it has a direct impact in the productivity in terms of absenteeism, presenteeism. And so there is that, and medical inflation is rising. So year over year, their medical cost goes high. So I've seen many large employers who have presence across the globe. So there is that cultural nuances also they have. I've seen them coming to us for consultative guidance. For large employers, it's not about giving them a standard benefit. It's co-creating what kind of challenge they have, what kind of budget they have, and then looking at what solution when we can put. So we did put something called an extended medical leave absence program with an employer where you identify some triggers and very proactively make sure connecting the member and the family, especially with some critical illness, connecting them to the right mental health resource early. Similarly, occupational therapy, physiotherapy, all this, connecting that care actually helped the employer reduce the overall number of months people used to be out on disability. So you could get the people back to work earlier, and plus the member is connected to all the assets they need to manage their conditions. We also have seen employers, we have different types of employers who are corporate kind, and there are employers who are more working in the field, like the UNs and the other agencies, where here we see that these employers go into the field during tough times, natural disasters, calamities. And you can imagine at that point of time their own mental health as well as dealing with people on the ground. So for this also, we partner with them to create the crisis line, because during war or natural disaster, sometimes even the brick and mortar facilities are all destroyed or non-functional. So how to create these kind of crisis line or even virtual telehealth facility where people can, and what we do is not only for those employees that only you have insurance, then you have access, we open it actually to the whole community so that people who even are not covered by the policy, they can access these kind of interventions or support.
Preventative in some ways, preventative. Renato, how important is data here? Because is this something that is, we know that there are prior stigmas. Sometimes people are reluctant. I'm sure, Stella, you see this, especially in an employee setting, to come forward and say to their organization, I'm struggling. Societally, we have a hard time saying it. What role does data play in measuring?
I mean, data is it's fundamental because of many reasons. And in fact, it's one of the weaknesses that we have noticed when we are following up the countries in the region of the Americas. We evaluated the plan of action that we have in the Americas, and we realized that most of the countries did not have a system to collect data on mental health. But only by having that system, I think we are able to see the magnitude of the problem and also to be able to use that information to advocate, to show to the ones that take decision that that problem is not being tackled the right way. And even more important than that, data is fundamental for us to go into details of which populations are more vulnerable, who we are not addressing, which adaptations we might need to do into our systems to be able to address the needs of people that probably have more difficulties than others. So that's a very important work that we need to do. I think by now we have an important volume of information, knowledge, and we have created indicators that can help countries to better monitor the status of mental health of their populations. And what we need is to transform that knowledge into action, to operationalize everything that we know by now about mental health of populations.
Yeah. James, when we're talking about making the argument, it sounds like this is an investment. If you do not make this investment, there are huge costs at the end of it. How do you get in front of decision makers and make that argument? Because it is asking them to pay up front for something that could save them further down the line.
Yeah, absolutely. One of the biggest problems in health advocacy I always find is that you need to find things that would give a return within a parliamentary cycle before the next election, and it becomes difficult. But, you know, a lot of these problems start way upstream. It could be issues around legislation. You know, the mental health legislation in Sierra Leone is called the 1902 Lunacy Act. It's old British legislation that hasn't been updated. You know, it has stigma in the title of the legislation. You know, those are things where you can point out to ministers that things need to change. Do you know there's 23 countries around the world where suicidal behaviour is illegal? That you get punished if you attempt suicide, you don't get help. It means you can't pick up the phone to seek help if you're having suicidal ideation. And in some countries, that law covers children as young as 12. You know, these are things that are hard-hitting, that you can work with other civil society, that you can work with technical agencies to make the case for and to create positive, progressive pressure on policymakers. These are things that I think are obvious, and when you make the right case...
When you start moving, then you get the momentum that moves. Yeah. Stella, I want to give you, as we start to wrap this up, I think you see employers doing this, and this is where the partnership is so important, because they've gone from talking about it in terms of stigma to a much more positive, proactive way of framing it. I know you do surveys around these issues. What can we take away from what's happening in corporate, and can this help inform perhaps on the governmental side?
I've seen it comes from the top, the leadership buy-in, and the leadership also opening up and being vulnerable. I've seen a lot. Last year we did something called the 5% pledge, where every leader, as part, like how we have our annual operating plan, every leader signed up saying 5% of our time we will be spending on mental health issues. People coming up and talking about like their own challenges, because if leaders don't talk, it has to come from top down. This has to happen. And another thing, what we have also seen is like mental health is also a common denominator for anything today. You look at it, chronic condition, there is mental health. Musculoskeletal is one of our big cost driver where we spend a lot of money. Again, mental health and musculoskeletal condition, if you don't treat the mental health and go and do an elective surgery, the outcome will not be optimum. So you have to do all this. So it's not, now there's no option. Like it's not a choice, should I go? It is important. It's important as any other, like if for cancer you're taking treatment for your cancer, equally important is taking care of the mental health, not only of the member, but also the caregivers, the family, all around. I see this like employers, in fact, the whole conversation has shifted. People want, we were talking about data challenges. Employees want us to come up with data, give them insights. And that's where the study that we do every year, this actually tracks the health and vitality trends in 11 markets, year over year, what is improving. So it's not only on the health, but also age in different demography, in young people, what is impacting. It's surprising. Young people are the ones who suffer the most with loneliness and the least resilient population. the elder. So how can they go and do targeted intervention? Because today it's like multi-generation, right? We have millennials and Gen X, Gen Z, all in the workforce. So they are coming to ask this very targeted, what we need to do, what kind of campaign we should run. So I see a lot of
Progress,
shift on the corporate side.
I think that's so important because then with that data, we all know, we've been talking all day, then it can be the information that both of you take in the work you do to make the argument, to get the investments that are needed. And just to pick up on your point, if there are similarities across, we just heard conversations about vaccinations and cancer, and all of it is about getting there early, preventative action, making local healthcare systems more resilient to deal with this. You know, there's a synergy across all of that that can help break down the silo, and when we're talking about trying to attract capital, really make a difference if we think of it all together. So a wonderful opportunity for us to be able to have conversations across all of those problem areas on the same day, in the same place, so that we can find a way to work together. Thanks to all of you. Thank you so much.
Thank you.
Thank you.
Please welcome